All right, we are live. Couple of seconds. Welcome everyone to AgileSherpas LinkedIn Live on Agile marketing in companies operating in the health and life sciences sector. Honestly, this is a topic I think that's really close to our hearts here at AgileSherpas because many of our clients operate in the space and sort of have to balance between innovation and strict regulation. But agility is possible, in fact, and super impactful when it comes to marketing products and services in this sector. So today we've brought together two perspectives, the coaching perspective and the practitioner perspective, to tell us more about some of the benefits and challenges and nuances of Agile in marketing for health and life science organizations. My name is Monica Georgiev. I'm a senior Agile coach and trainer with AgileSherpas and our host on LinkedIn, bringing together Agilists from our network to share their experience of different aspects of agility, whether it's in marketing or the business more broadly. I'm joined today by two wonderful guests who I have had the pleasure to work with in the past couple of years in different capacities. Thank you so much for joining us. Colleen Dunn-Hartunian from AgileSherpas and Katie Jeske from Charles River Labs. I'd like to start with a quick intro from you both, because I think you'll do a better job introducing yourselves than I would. So we can hear about how you got into Agile in the first place and your path to having more of an experience with Agile values, principles, and practices in this space that we're focusing on today during our live. Then we'll jump into some questions I've prepared. And I invite everyone who's joining us live today to ask questions that you might have for our presenters, our guests, in the chat, in the comments below where you're streaming this live. I'll be keeping an eye on that. So if you have any questions for the presenters, please put them in there. We will have time for a Q&A at the end of our 60 minutes together today. So we'll put aside maybe 10 or 15 minutes at the end of our panel to go over those. But if it's something quite urgent or you just want to call somebody out, you totally can. You'll be seeing those on the screen live as they come in. So thank you for joining us, Colleen, Katie. Let's start with Colleen, a quick intro.
Sure. So my name is Colleen Dunn-Hartunian. I'm broadcasting to you live from Nashville, Tennessee. I'm originally from Boston, Massachusetts, but I moved down here about 5 years ago. I am a trainer and coach for AgileSherpas, like Monica mentioned. I got my first taste of Agile about 8 years ago. I started off as a writer, internal comms. I started at this company, and about 6 months in, they said, "We're going Agile. Do you want to be a Scrum Master?" And I said, that's not a real word. I don't know what that is. And so from there, I really immersed myself into Agile within the marketing space, drank the Agile Kool-Aid, and fast forward 8 years later, I now have the opportunity to train and coach companies all over the globe, certainly all over North America, and help them with their Agile transformations.
Katie, over to you.
Thank you. So my name is Katie Jeske. I am the Associate Director of Safety Assessment Marketing at Charles River. I got my first taste of Agile about 2 years ago. Charles River, there were a few departments within our strategic marketing side that was going to pilot the Agile marketing framework with the goal in mind to roll it out to the larger marketing organization after that. So I've gotten to have a taste of both a worker and a Scrum Master, similar to you, Colleen, two vastly different worlds, but it was wonderful to see all the benefits we gained after that. Thinking back to my experience before Agile, I'm not really sure how we functioned. It's been a great benefit and been a great experience thus far.
I think you both covered it a little bit in your intros about how you first got into Agile, but what was the reaction the first time that you were learning about it or getting trained in it in your different contexts? Colleen, you said that you were sort of, you jumped into it, you dove into it head first. What was the reaction? What benefits did you see? What were the challenges initially?
Yeah. So initially I was terrified. I'm 6 months into this brand new organization. I'm used to writing internal communications, and they were all about breaking down silos because this was a huge global organization. So they didn't need an internal comms writer for that particular silo anymore. So I think the initial reaction is resistance and fear, right? But I wanted to remain employed. So it was being open-minded. And then I quickly realized all of the things I actually really enjoyed about my job weren't even necessarily specific to my function as a writer. They were all about building relationships with team members, improving process, work-life balance, and really creating a creative environment for people to thrive in. And so once I sort of realized that Agile created a safe space for that and really encouraged it and fostered it, I was all in. So I got to experience a transformation from the ground up, having zero context, which I think really helped set me up to be a trainer and coach and help other people through it because I've lived it and I know what it feels like. Katie, what about you?
The piece about fear, the initial onset, was my first gut reaction, mainly from a time perspective. I was like, oh my gosh, how much time am I going to spend organizing, my work, coordinating it, all of that. And as I learned a little bit more about it through the different certification trainings and such, I was like, oh my gosh, this is going to change my project management piece of it a little bit. I'm going to have a better view of when my projects are going to move through. It's going to help me, manage my time so much better and strategize how I can really put my campaigns together. And once I realized that, I relaxed so much more. And when I, like you said, dove in the deep end, I was ready to go. And then I quickly, shortly after that, about a year, I became Scrum Master for our small strategic team. And that really opened my eyes to the true benefit of it and how you can improve your velocity and know exactly when campaigns are going to start and end. And so it really did, once I got past the fear part, and mind you, that it was only, I think, a week or two, it really opened my eyes and it has balanced things so much better.
And Katie, I actually remember because I was coaching the teams over at Charles River. So I remember what your first experience of Agile was. And I think definitely starting with training and getting people familiar means that fear moment is truly just a moment and not a long period of time that sets you back. So I remember how important it was for people to get exposed to unfamiliar terms and just leave that fear behind as soon as possible and sort of jump into it. But Colleen, you've gone through an Agile transformation at your previous role, but you've also coached organizations in the health and life sciences sector through their own transformation.
Correct.
Was what Katie was saying, was that sort of similar to what you've seen?
Yeah.
In new organizations getting introduced to Agile in the space?
Mm-hmm. Yeah, especially with the health and life sciences client that I've had was a very large pharmaceutical company, and they were so much bigger than my company. We were going through that Agile transformation. So there was a lot more at stake, right? And those companies, as we'll talk about today, they are regulated much more differently. They have different rules of engagement. They have a completely different culture. They have a different standard that they have to reach, and different skill sets among them. And it's a lot more, what's the word I'm looking for here? It's a lot tighter. They have a lot at stake there. There's not a lot of room to make mistakes. So everything Katie was saying, I one up that for sure. Plus one there. I've seen the same thing.
So ultimately, would you say that the way Agile manifests in marketing for these organizations, does it look any different, in your opinion, as someone who's coached different types of groups in different industries? Does it look different in the health and life sciences, the way that Agile manifests? And then we can go over to Katie and see whether that's a match to what's been the situation at Charles River. after
Yeah,
several
that's
years
a
of
great question. I think there's a lot of similarities, right? Because at the root of it, you're still having people on your teams. People are the root of everything and the root of that change. So all of the feelings, all the anxiety that they're going through, you're going to get the same regardless of the marketing team. But what you layer in is that regulation, certain level of bureaucracy, maybe very strict hierarchy, red tape. You're going to have a lot more stakeholders in the health and life sciences environment, strict budgets, things need to go through many more approvals. So you have some of those barriers with traditional marketing teams, but you just see it on a much stricter scale in health and life sciences. And you need to build in room to address those things, because if you don't, it's all going to fall apart. So definitely you need to address the cultural changes, but definitely the process and the regulation and approvals, it's really heavy, and you need to make sure that you're mindful of that when you're going through a transformation in health and life sciences.
And Katie, is that true for Charles River as well? How did you guys deal with those stakeholders, the regulations, the budgets, all those considerations that Colleen brought up?
It's an important piece, and within Charles River, the stakeholder piece is a little bit more rigid and strict than the regulatory piece. At Charles River, we're with a recent acquisition, we're now having to weave in the IRB approvals and such that you would see with pharmaceutical companies, patient marketing, all of that. But within our small team, within safety assessment, and even with discovery and microbial, maybe the regulation piece isn't as strict for us. However, I can speak to the stakeholder alignment. So on the forefront of Agile, we were very open with our various levels of stakeholders. We have commercial leaders, we have scientific operation leaders that we partner with on a regular basis. And we got in front of them and just educated them on how we were working before, how Agile is going to help us in the long run, and use data also over time to help them understand what our bandwidths are, why we're trying to prioritize certain things, and also lay out expectations across the board. Obviously, with working in the scientific industry, there are a lot of things that marketers can't just publish without a scientist or a bench scientist really reviewing that to make sure that the data is accurate, make sure it's being portrayed in the proper way. A lot of the times with scientific posters, for instance, for different industry congresses and conferences, we're working with pharmaceutical companies that have legal teams. So we have to be aware of that and work that into our processes and workflows to make sure that we get all those necessary approvals. And I think that's where Agile can actually benefit teams, because you can visualize the workflow. You can break certain projects down to make sure that you have time to get those approvals. And if somebody's not getting back to you, ask the question, is this something that I can move forward with and feel confident in, or do I actually need somebody to approve it? And you can anticipate some of those pieces a little bit better. And anticipate changes along the way too. So it's just a little bit there.
Yeah, the stakeholder alignment piece has always been key, I find. And has this approval process, or I guess the way that you communicate with internal stakeholders, has that changed significantly now that the process is a little bit different? And in what way has it changed?
For me, it's changed for the better. It's a lot more efficient. Our team, I'm very proud of every single one of them, actually. It's very hard to go to a stakeholder that you may consider yourself reporting to and somewhat explaining to them, we're doing this, we're doing this project for X amount of reasons. We're trying to increase new business. We're trying to gain, more market share, whatever the goal is, right? And in order to do that, I need to have your partnership for X amount of time. And when I send you certain, whether it's an article or a web page or whatever it is it okay that we have your final review and approval in, 24 to 48 hours. We push on them a little bit, and we're very open and ask the question, is it okay that we turn this around a little bit quicker? Because otherwise, there have been projects that can hang out there for a month and they just don't understand why we need to move on it quicker. So, and that's kind of why I'm very proud of the safety assessment strategic marketing team at Charles River, because we have reset the standard and we're just very open and honest with them. And will these deadlines work? Can we do this? And most of the time they say yes. And in other situations, it's like, ooh, I don't know. I've got these studies that need to be executed. I don't know if we can deliver on that. Okay, well, what's the solution? Can we pull in another expert? So it's just trying to figure out who the right people are and being open and honest.
And making it a conversation, right?
Yeah.
I think what Colleen was mentioning before about the reality of organizations in the space is that you do have the hierarchy, you do have those ground rules that people feel safe in adhering to. But actually, if we open up a space for conversations with stakeholders, we're able to get our work done faster. We have better partnerships with them, and we're able to provide value at a faster rate because the approval process is sped up. But yeah, taking the time to have that conversation is crucial. Colleen, you were nodding along the whole time. You were like, exactly. This is exactly what I've seen.
I'm a little bobblehead over here. I'm like, yes, Katie, absolutely. Yeah. So that was one of the biggest challenges with the teams that I saw for my client, which was a pharmaceutical company, and how they were organized, how their teams were organized. They were organized around a particular product, right? A particular drug. And so approvals, it was a huge thing for them, and it was really slowing them down. And so what they ended up doing, they work in 3-week sprints. So for each week of the sprint, they actually have their approvers, their compliance, their legal for a certain number of hours per week. So they know that Thursdays from 2 to 4, we have our time with compliance to review anything that we're working on. So we're going to prioritize the first few items in the sprint that we know we need early approvals on to get them done at the end. We're going to bring it to the table. So they're not sitting around waiting for days, waiting for somebody to get back to their approval. They have built-in time in the schedule where they know they have that time dedicated to be able to get that stuff out the door, which has greatly changed how fast they can get things out the door, how they can experiment with things and get that feedback. But they also, since they're working more in a sprint framework, they are doing sprint reviews and demos with their stakeholders. So after the end of those 3 weeks, let's talk about what we created. Let's talk about what's been out in the market for a week or so, or a few weeks. Let's share that data. And all the stakeholders together, they can hear what's working, what's not. Maybe if something's performing really well, we want to dive into that a little bit deeper and put more resources against that. Or maybe we need to cut ties on a project that we thought was going to do really well. So they've created and built in the space for both that stakeholder review and for the approvals with compliance, legal, et cetera. And it's totally changed the game for them. And they're able to move much more quickly and produce more meaningful work because of it. That's why I was nodding like crazy, Katie. I hear you there.
And so how often in both cases, I guess is my question, do we want to be looping in our stakeholders when we're operating in this space? Because obviously I think we've identified that it's better to talk to them more often. It's better to have a conversation than to not. But I think those optimizations in the process that you were talking about, Colleen, every once in a while checking in what's working, what's not, does this SLA make sense anymore or not? Having that dedicated time on a Thursday, like I'm sure that was a conversation, and the outcome was having that space created for stakeholder reviews to know and anticipate that you can reach your stakeholders then. How often do you think we should bring them in? The reason I ask that is because I was recently part of a quarterly planning where stakeholders had such a big role, and they had not been part of conversations like that before. But it was really beneficial to have them there because they could actually call out risks or future legal and compliance issues that they anticipated from projects that hadn't even been started. So the teams were going in, again, in a very highly regulated space, going in with the knowledge of this project, there's a watch out we need to be aware of before we even start the work, so that we don't have to go back and redo once we hit compliance. So how often would you recommend keeping stakeholders aligned and in the loop with project progress? Is it quarterly, weekly, sprint, every day? Katie, what's been your experience? And then we'll go to Colleen.
For Charles River in particular, I view it in a couple of different levels. So at the highest level, we are touching base with stakeholders, and that includes sales, scientific operations, regional general managers, you name it, right? We're touching base with them quarterly, primarily to focus on the output data, what influenced opportunities our campaigns are bringing in. And during that quarterly touch base, we're also visiting what campaigns or strategic initiatives we've prioritized for the year, where do we stand with them, and if we need to shift any priorities. One thing that is regularly, or I guess particularly unique with Charles River, is we are very nimble in nature. It's less rigid as a pharmaceutical company or say a generics company that they have a set marketing plan for the year and they don't stray from it. There are opportunities throughout the year where if our commercial team is looking at our performance data, there could be an opportunity where it's like, oh, actually we need to, increase our backlog for one particular service. You know what? Let's have a conversation and see if we need to reprioritize the campaigns for marketing or the initiatives for sales. So we do that at a high level every quarter. Coming down a level, there are also stakeholders that are actively helping us to develop content. And that's where the marketing managers are touching base with their individual stakeholders, anywhere from biweekly to monthly, where they are talking about the nitty-gritty details of putting content together. We have an idea in mind. What's the best path forward? This is what customers said about it last time. These were the influenced opportunities and the dollar amounts that came against those campaigns. Are we making the right decision? So there's a couple of different tiers that we not necessarily enforce, but put into practice there to keep our stakeholders in the loop and make them a part of the decision process as well.
Exactly. And Colleen, in your experience, is it a similar sort of cadence, keeping stakeholders in the loop quarterly, but also at reviews? How often does it happen?
Yeah, it's definitely at the quarterly level and at reviews. So the teams that I work with, they practice with OKRs, right? So getting alignment from the stakeholders on what are our big rocks that we're all going to agree on for the quarter. We're going to prioritize everything against that. But then also at the sprint review level, after every sprint, there is one situation that's coming to mind where this particular team, there was a competitor that had a new drug come out that was directly competing with what their team is producing. And that greatly shifted the priorities, right? So all of the stakeholders needed to be there to say, we know this is now the number one priority. We have to react to this. What's going to move? What's going to shift? Because we need all hands on deck for those other things. So it was really helpful for them to see what was in the queue, what's coming up that's a fire drill that absolutely has to be addressed, and what's going to give. So there's benefits to having it both at that kind of strategic level and then more at that a little bit more micro level to be able to shift as needed.
I'm sure there's a lot of people viewing us live right now that are wondering maybe they want to apply similar sort of tactics to their own process. From your perspective, what is the hardest part about applying agile ways of working in marketing departments within this regulated space? If you could call one really difficult part of it out, what would that be? Let's go to Katie first, because she's off mute. So I thought maybe she's ready to go. So careful with that. And then we'll go to Colleen.
Again, I think it comes back to the review stage, and also balancing that review timeline with the idea of an MVP. Going back to the example that I shared earlier, if you're working on a presentation that other companies are involved in, you cannot move forward without legal approvals. So trying to break down the project and anticipate when you need certain things completed, that can be a challenge. Because then at the same time, say you get the approvals at the 11th hour and the presentation is in 3 days. What does that mean for the creative process? If you just have a copyrighted draft, for instance, you now have to figure out, how do I get this project completed without messing up our workflow? So what our team has been doing is we stay very close to one another, both from a strategic and a marketing operations function. We're now having a daily stand-up 3 times a week, so that if we do need to completely shift and reprioritize projects to say, I've got to put these 2 things on hold to make room for this, high priority project, we can do that, and everybody is on the same page. And our team in particular, it's not just safety assessment marketing, we're also partnering up with discovery. So we share team members, if you will, creative, graphic designers, web designers, email specialists, you name it. And so it's really nice to be able to partner with those teams to say, hey, I'm really sorry that this came up, but we got our final approval. Is it okay that we bump these projects down, put them on hold so we can make room for that? So that's that piece was challenging, but now that we've got it down to a science, it's worked out. So I don't know if that answered your question.
It does, because I remember it being a challenge, and it took a lot of like motivation from the various team members involved to really get to that point where it's sort of part of our routine and it's part of keeping the process relevant. But that reprioritization and those pivots can be very disruptive if we're not used to reprioritizing so often in reaction to things that are happening, right? And they were happening before. It's just that the process was not set up in such a way that we could react to them so readily. I think it takes some time to get used to it. But I also remember that having that strategic stand-up, I don't know if that's still part of the process, but I remember it being so helpful to bring, even in the beginning, just to bring the Scrum Masters or team leads from the shared resources to the strategic teams, bring them to one forum daily even, or every other day, to talk about whether there was any prioritization that needed to shift, and then relaying that back to their teams so that there's a bridge between what's happening in priority. Do the teams know about it? Is there alignment? All right, let's execute on it. So those several touch points, I think, really helped from my perspective as a coach.
It did really help. And we're still doing that. And actually we've expanded that a bit. And the benefit with expanding it to the larger team, all the workers involved, the marketing managers, the Scrum Masters, all that, we now have gotten to a point where we can use 15 minutes every morning to alleviate issues, or if something got hung up somewhere, it's a quick update, you move on with your day, and it's all set and everything's on track. So that's been a huge
good investment of time, I think. 15 minutes to solve big, thorny problems.
Yeah, I'll take it.
I'll take it too. Colleen, what about from your perspective, what is the hardest thing for these types of organizations to really adopt Agile in their marketing departments?
Yeah, I have a slightly different answer. I definitely think that, Katie, what you mentioned, those are real challenges. What I see, especially from a coaching perspective, the most difficult thing in making Agile work is having a shift in mindset about not having all the answers right away and not being perfect at this right away. And pharma folks are typically used to having a very clear path and needing to communicate a very robust, perfect plan, these slide decks that are filled with words, and presenting them out in these strict deadlines. And panic sets in when you ask them to test and learn and to experiment a little bit. I remember when I was first creating OKRs with my first team, they were very nervous about it because they thought if they didn't meet these goals, that was going to be it for them, right? Their head was on the chopping block. And that's not the case, right? These are goals that we're putting in there to make sure that we're stretching ourselves. So it's okay if we don't meet those goals 100%. Also, it's the first time you're doing it, so it's going to be fine. But there's a lot of fear of failure. And they need to build up that psychological safety within their teams and actually see how it goes, to really quite understand what the spirit of Agile is supposed to be. So I think the mindset shift is the trickiest thing, in my opinion.
Colleen, you got a lot of reactions in the
Oh,
live
did I?
around that. People were like, yes, that's totally true. And I think I definitely agree. And it's one of the biggest points of pushback for Agile. I've heard from organizations in regulated spaces that they can't afford to experiment with their marketing, and they can't afford to do campaigns and iterations. The stakes are just too high. We can't put something out there that's half baked. Our reputation is on the line. And I completely get it. I understand, because it's not part of the way that they would traditionally work. And I always bring up the example of like a clinical trial, which is something that everyone, whether you're on different sides of that industry, you know what a clinical trial would look like if it were to take place. And it is exactly that, right? It's testing something out in a life or death, high stakes situation, and testing it out in different capacities, right? Testing out different criteria, different characteristics of the product, with smaller groups initially, larger groups later. In the end, the goal is to deliver customer value, right? So I think that always hits home for people that are coming from the health and life sciences, because they're like, yeah, I guess we do that for a clinical trial for a new drug that's coming onto the market. Why don't we do that for our marketing campaigns, right? It's totally feasible as long as it's done in a risk-free way, and the design of the experiment is such that customers may not even know it is an experiment, right? But you're collecting data from them as they interact with the different campaigns that you put out there. So I wonder if each of you has seen like a good example of an MVP to remove some of that stigma that MVPs are not possible in health and life science organizations. Do any MVPs come to mind that you've been part of, any tests or experiments that you've done? And whoever has one on their mind. Yeah, go for it, Colleen.
Okay. All right. I'll go first.
Do it.
So going back to what I was talking about before about that stakeholder involvement, about needing to prioritize when a competitor came out with a new drug, right? They really got creative in how they were going to respond to this. So there were no guidelines yet on what they were allowed to put out, but they knew that they'd be coming. But as soon as the guidelines hit, they already had approved reactive messaging in one day, right? They knew it was coming down the line. Let's see what we can do. We know that we have this time coming up. Let's have that messaging ready to go. So they had that approved reactive messaging in one day. They had proactive messaging in 5 days. And then at the end of their sprint, they had 6 different resources that they had created and were approved and released. And within those 6 different resources, they actually did some experimentation with messaging on their websites to help patients engage with the content. So when you have a drug, there's all different kinds of rules about what you can put in your marketing and what you can't, right? You can't necessarily offer a coupon or a voucher to anybody, and there needs to be somebody prescribing it, right? So they were trying to get creative with different ways to get their patients to engage with their page and to really learn more about the drug. So they had created conversation starters with their doctor, right? Like a different handout that you could use to help talk to your doctor about that particular drug. They created a symptom quiz, and also different formulary accessibility documents, because there was a big perception that this drug wasn't covered by insurance. And a couple of years ago, it wasn't, right? But they were able to come up with these quick things that they could put on the website. And it didn't take a lot of effort. It wasn't a huge lift. They could fit it all in one sprint. And they were able to see how their customer was engaging with that material. And then they were able to bring that data back to the sprint demo. And they saw that they regained 6% market share after it had initially dipped with the new drug. And so they're continuing to build some of those things out. So there's definitely space to experiment. You just need to keep it small. You don't want to experiment with something that's huge and high risk. That's going to take you multiple sprints, multiple weeks, a whole bunch of money to do, right? You want to find a way to break it down into something that's both minimum and viable. So it still has value. You can get that data and figure out how you want to make it grow from there.
And before we go to Katie, I just posted in our comments here for the live an article that came out on as.com just 2 days ago about MVPs in more regulated industries, which includes others like tobacco or banking and financial services. So take a look at that. A lot of what Colleen mentioned is reflected there too, right? The balance between minimum and viable to make it work. But Katie, what experiments come to mind for you? Anything that you've been part of work particularly well?
Yeah, it's interesting, right? Because we think about minimum viable product in the Agile framework, and I resonate, Colleen, when you mentioned the fear around failing, right? But when we take a step back and look at past marketing tactics, we're used to that A/B lifestyle. So it's not anything different. It's just maybe on a smaller scale. And so when you break down your audience to try to test something to see what the reaction would be, we're doing a lot of the similar things. The piece that actually is coming to mind actually is happening right now. We had an interesting webinar take place this week, and it was very successful. We had to be very sensitive with the topic at hand. Within our industry, right? There can be challenges with stem cell research and things like that. And so there are just sensitive topics that we have to be wary of. However, we hyper focused the audience for that webinar, targeted only clients that had specific work in their pipeline for that type of study. And we ended up getting I think it was the end of it, 52% attendance rate. So as we took a step back, our stakeholders realized the success behind that. And I had a conversation about, well, what are we going to do with it next? How can we roll it out with such strict sensitivities behind it? How can we leverage that because it's working? And so we're now starting to have those conversations. The piece that is tricky when we're testing is, for us, it's a channel. What channels are working? What are they engaging with? And if they're not engaging with a specific channel, it's okay. Marketing is this live organism that we're constantly testing. It's very seasonal in nature a lot of the times. So it's like, okay, that email campaign didn't work as a follow-up piece. It's okay. How can we re-engage that audience in a different way to get them to react? And that's the phase that we're in right now. And then the onset of that, staying close to the customer. We do more voice of the customer one-off, where if they shared with us specific feedback, we'll ask if we can have a conversation with them, walk them through some different pieces. How do they engage with certain digital media aspects? So it's an ongoing effort, but all I can say to young professionals and even other marketers, you can't be afraid. It's okay if something doesn't work. Let's just look at the data and figure out how we can re-engage them to make an impact long-term.
There's a difference, Katie. I liked what you were saying between a campaign failing and a person failing.
Yes.
And I think we internalize that a lot. And it's like, no, it just didn't work. Let's learn from it and move on. It's not a reflection on you as a person. It doesn't make you a bad marketer. It makes you a healthy marketer, that you're testing things and going from all different angles.
I feel like right now it is very hard to be a marketer. We would need endless budget, endless people on our team to use every single channel out there, every single digital media tool. It's overwhelming. And so a lot of the times when you're trying to step out and try something new, it can be very scary because you're almost putting money behind it. And if it fails, what does that say about us? But you know what? If you don't try new things, you're not trying to grow as an organization either. So it really is just a true A/B test from years past, and figuring out what will work next.
There's a lot of heart emojis popping up on the screen in LinkedIn. I think people have sensed, right, that is a crucial piece of our reality as marketers, no matter what industry we're operating in. And what you're saying, Katie, really brings me back to Colleen's call out about what the hardest thing is. And it's all about mindset. And there is an agile principle about failing. Don't be afraid to fail. I was going to say fail fast, which is a totally different thing, but don't be afraid to fail. If you want to fail fast, fail fast. Just don't fail the same way twice. And I think there's so much innovation that comes out of having the safe space to experiment and innovate. Because I've noticed working with organizations in this sector myself that there is a lot of emphasis on output, being able to be in all the channels, right, doing all of the collateral that we've always done. And because a lot of these organizations are multiple decades old, there's so much like legacy assets that are no longer relevant, but people feel like they need to keep the machine churning. So they're continually producing more and more, which makes them feel very overwhelmed. And when they start to prioritize and pivot around the current state, they feel like they're producing less. And then they say, okay, in Agile, I feel like we're not doing more. I don't know if we're being faster in producing this work, because a lot of those myths are still circulating that Agile is about doing more and doing it faster, which isn't always the case, right? And so I feel like we always have to go back to the values and the principles, not just the practices, which are more visible, right? The stand-ups, the reviews, those are all great. But going back to the values and principles and reminding people that going Agile doesn't always mean that you're going to be producing more. You're just going to be producing more impactful work. That doesn't necessarily mean it's going to be more campaigns or more assets, which is once again a mindset issue, right? How are people being evaluated? Hopefully it's based on outcomes too. God, that's a tough lesson to learn and so important. Absolutely agree. You're not seeing that in the chat. I'll bring it up so you can see some audience interaction here, but absolutely. All right, so we've got some examples of MVPs. It is possible, it turns out. I imagine that a lot of people are wondering what it takes to scale this approach, because one Agile team is one thing, but an Agile organization is a totally different thing. And I think both of you have seen examples of how one pilot team can turn into more Agile teams working together. So what is your take on that? What does it take to scale agility in marketing departments in highly regulated industries like yours?
I can go first. So to your point though, Monica, real quick, to the larger organization, when we think about companies being agile, the entire company does not have to be operating agilely. Your IT department might be operating agilely. There may be another department that works in a similar way. You can have a positive impact with your stakeholders and others to make this framework work, right? So the make it or break it factors from my perspective, and I know I won't repeat myself because we had that conversation about stakeholder alignment from the beginning, but another factor is data, living and breathing the analytics and the data of how your agile team is functioning, trying to figure out what metrics you want to track to see if it's having a positive impact. What are your campaign results as far as dollar evaluations against those projects? Because ultimately, that's going to help you to propose strategic initiatives and campaigns in the future and how you make those priority decisions with your stakeholders. So that overall is going to tell you, the data itself is going to tell you what you should be doing and what you shouldn't be doing from a holistic optimization standpoint. Because ultimately that's what matters. From our team, I really want to focus on the campaigns that are going to have the highest impact and yield the highest return for Charles River safety assessment. So out of a campaign, when we talk to our stakeholders, what are the top 5 things you want to focus on for the year? And what are the revenue evaluations against that? because that's where we really want to make an impact, and using all those different data pieces will help to make those decisions for you, if you will. So I think, yeah, stakeholder alignment, data, and just going back to the MVP piece that we were already talking about, I think those are the things that should be at the center of making agile work in your company, if that makes sense.
And data would show you which teams maybe adjacent to yours might be good candidates to move to this different way of work. I've seen that. And data is very convincing, much more than opinions. Mm-hmm. Definitely. Colleen?
Yeah. So I have two different answers there. So I think the first one is take your time with scaling. Don't try to boil the ocean and just have everyone go all at once. The way that I've seen it work really well is, well, again, we'll go back to this pharmaceutical company. There's one business unit that started to do Agile, and then they're going to branch out into vaccines, to all these different things, right? But so this really served as the pilot group, and there were so many learnings that they learned along the way. So whether it's clarification of roles, maybe the tool that they purchased didn't work out the way that they thought it did, and there needs to be a gap that needs to be filled, that compliance and approval things that we talked about, and creating a space for people to share best practices and what they've learned. From then, once you have that group that are working in that groove, you can take those learnings and help them shepherd the rest of the organization, right? Take those different learnings. So I think there's great power in pilot teams instead of just trying to do it all at once. The second point I'll say is I've seen the most successful organizations really in Agile have Agile champions. So there's a dedicated person who's responsible for overseeing the transformation. As we know, especially as marketers, our lives get crazy, and there's all these different things in the market that we have to respond to. And it's so easy after you get things good enough that you put Agile on the back burner, right? And improving your process on the back burner. If you have a dedicated person that's responsible for making sure that we are continuing to improve, we're pushing ourselves, we're sharing best practices with other departments, it's going to be a game changer in the health of that transformation, because their transformations are bumpy, but if you have somebody that's looking out for you along the way, it can make a really huge difference. So pilot teams and an Agile champion.
Yeah, I've heard it said that if everyone is responsible, then no one is responsible. So if we're all in this together, and that's certainly the truth, but having that Agile champion, I've also found to be very, very beneficial. And I'm also imagining that people are wondering how long it takes for people to get into that groove that you mentioned, Colleen. Like, how do you know the pilot team is ready to share learnings out to teams that are going to take them and go with it, right? They're going to be spending a lot of time standing this up in their own way.
Yeah. I wish there was a magic number that I could give you. I will say that pretty early on, you're going to start to see those learnings. Well, anywhere from 90 days, right? When people start to get a couple sprints under their belt, a couple months under their belt, they've made some mistakes. They're starting to iterate, right? They're starting to make those different changes. So you get learnings early on. I would say don't try to scale after a team has been in place for 90 days. I would wait a little bit longer, maybe wait until 6 months to a year until people feel comfortable with what they're doing. You see your teams asking questions that are really kind of pushing the needle as far as, are we really breaking down work the way that we need to? Are we prioritizing the right things? And you see them adopting the mindset instead of just having those practices in place, instead of just going through the motions of a daily stand-up, having a sprint review or whatever. When you're starting to see the culture change, I say that's probably the key, that they're ready to start educating other people.
Yeah. And Katie, correct me if I'm wrong, but you were part of the original pilot group at Charles River, right?
Yes.
And how long, if you remember, how long do you think it took that group to sort of get settled and be in a place where they could confidently like recommend next steps for other peers who weren't working in that way?
Yeah, that's a tough question. And I relate back to Colleen, to your point, the culture, right? At first, it felt very manual in nature. I have to join these stand-ups. It's taking time out of our day. So I want to say it was actually probably a little bit past, between the 6 to 9 month standpoint, to where it was second nature at that point. We were used to it. We were in a flow where Agile really kind of opened our team up was more or less in the retrospective meetings, because everybody was allowed to be honest and open and share the ugly, celebrate the wins. And now seeing where we're at now, it's almost as if we do our retrospectives, but there's not a lot of bugs that are there now, because everybody is just so quick to alleviate issues or bring roadblocks up at the forefront, and we fix it right away. Where there was that 6-month span where I think there was just that fear of saying, I don't know if I like this. Do I really want to share how I really feel? But we broke that down over the course of time, and it did help. And now that we've broken it out into much larger collaborative teams, people are a little bit more honest across team lines too, which is healthy to see. I will say it that way. So I would agree with Colleen in that there's no magic time frame around that. But when you see that cultural shift and see team members and workers fixing issues on behalf of themselves, that's when it's like, okay, I think we've hit a good place.
I've seen it work both. Maybe outbound and inbound are not the right words, but you catch my drift. So it can be outbound, where the team gets to that maybe 6 to 9 month mark, Katie, like you were saying, and goes out and shares their learnings, their story, what they recommend, and whoever wants to picks that up. I've also seen the other version of that, where teams start knocking on this Agile pilot store and are like, please teach me what you're doing. I want to be part of this. It looks really cool. You guys seem to be like making the most of this. How can I leverage it in my own work so that we can work better together? And it's often those adjacent teams, right? They see the stand-ups, they see the visible components, and they want to get to the heart of what that would mean in their own line of work. So I found that work really well, especially when it's desired, right? It's not something you're pushing out. It's something that people are coming in and wanting to learn about. So that's been wonderful to see. And especially in those pilots, I often find that if the pilot was together just to test out these practices and they don't need to be together long term, they're often broken out and they form Agile teams around themselves, and they become the champion of that team because they were part of the original pilot, right? They were there from the start. They were a pioneer in Agile in the organization, and now they're scattered in a sense, joining different teams and setting up new Agile teams around themselves. Have you guys seen that happen? I know maybe Colleen is better placed to answer it because she's seen all sorts of different teams.
Yeah, I think that model works really well because people have a peer that have been through it before. So it can help put them at ease. They understand the business, they understand the nuances of the company and some of the real challenges that they're going to have, and they've lived through it. So I've seen that model work really, really well. If you have one singular pilot team that's organized maybe around the project, and then they sort of dissolve, and then they're planted in these other new Agile teams, it can be really beneficial to help get those other teams up to speed quickly, because they can share their learnings in real time, right? You don't have to wait a couple weeks for the next workshop. They can just share it right away.
Totally. And Katie, if you have any thoughts, please, you're welcome to chime in as well if you've seen that happen. But if not, then we can move to some questions from the audience.
I think we're ready for questions.
Let's do it. There is one question. I'll pop it up on the screen here and give it a read. It's from George Lellis. He's a chartered marketer. Which frameworks or processes from the tech world would you like the health and life sciences industry to adopt that you think would be beneficial and make Agile marketing add value to the business? So I imagine we all work with tech teams in one way or another. They're part of health and life science organizations as well. In my experience, the only experience that I've had with this is that we actually brought Agile into marketing first, and the IT team adopted it from them. So it was the other way around. It's not what you would expect because Agile comes from tech. So you would expect that the tech team, the IT team was already Agile, and then we brought it up. But no, so I don't know if I can really speak to that because now the tech team is adopting what they see the Agile marketers do. Totally different scenario. What are your thoughts, ladies?
From a practices standpoint within marketing, and granted, where Charles River is very different from pharmaceuticals, where you're pushing out a product into the market, so packaging is involved, bottle label, like all of that speaks volumes. Where products and services is a little bit more soft. So where I think, and even as I look back on our team too, it's weaving in that client feedback loop more and more and more. I feel like you cannot listen to your clients enough. And, as marketers, we roll out webinars, we roll out trade shows, for example, and it's easy to get one-off comments from clients, but just formalizing that more is a practice and a piece of Agile that I can't emphasize enough, if that makes sense. So George, I don't know if that's just one example to share to your question, but.
Colleen, any thoughts?
Yeah. So one thing I'll add is, especially when we're talking about different practices here, and we talked a little bit about sprint review or demos, but one thing that I think that marketing teams can leverage from those IT teams, especially in a sprint review, is really tying their campaigns back to impact, right? And data. So traditionally, especially if we are a marketing team that's focused on outputs over outcomes, we can measure how many landing pages we did, how many email campaigns, how many video campaigns, blah, blah, blah. But it's not necessarily a muscle that we flex to tie that back to ROI. And we're constantly asked that as marketers all the time. We're always lobbying to keep our budget, right? What's our value? How are you impacting that? How are you supporting sales? And awareness, right, isn't really something that you can measure. So I think one thing that they could leverage is really tying it back to the data piece. And how can you prove that what you're doing is actually making an impact? Maybe it's anecdotal data, or maybe it's straight line data. It's fine. But really trying to get into that mindset of how can we test and make sure that what we're doing is working, not just because we like the campaign and we want it to work, or because the loudest person in the room told us that we had to do it, right? Let's get really technical and discerning about what we're actually putting out in the market and making sure that it works.
Awesome. So we've got one more question from Molly Ferns. Do you think adopting Agile in your marketing teams has pushed or accelerated digital transformation at your companies? A thing I think the health life science space can sometimes be on the slower side of adopting. Whoever feels comfortable answering first, take the lead. Thank you for your question, Molly.
I think it has. I think digital transformation within Charles River is a growing area, especially when you bring it back to marketing. You have to be aware of new technology that's coming down the pike and how you can engage with clients overall, even how you serve up services to your clients and what they expect from you, right? So I think our digital teams and marketing have really embraced Agile, and that's my personal opinion, and it's been really fun to watch. What has also been really beneficial with our teams as well is I've been able to reach out to Scrum Masters within our design teams on our digital teams at Charles River to ask how they're using Agile, what are their ways of working, and how might we be able to improve as a strategic team to better our processes, funnel our work in more efficient ways. So it's kind of answering two separate questions there, but I've seen a positive impact in speeding that up from a digital perspective. Colleen, I don't know if you have any thoughts.
Yeah. So the pharmaceutical company that I was working with, they thankfully were already starting to adopt agile ways of working at the start of the pandemic. And they had to drastically change the way that they were creating materials, right? So no longer could a sales rep bring a physical piece of paper into a doctor's office and leave it with them to digest and then share that information with their patients, right? So they very quickly needed to completely pivot. And while they had some digital assets, right, they really just needed to build that totally out because the way that they were reaching their customer was entirely different than what it was before. So working in agile ways really enabled them to be able to make that digital shift a little bit faster than maybe they would have if there wasn't a global pandemic. I think it turned most of our lives upside down. But I definitely saw a change happen there around that. And Agile was able to make that happen a little bit faster than it would have been if they had to go through that traditional waterfall way of planning.
Right. Thank you, Molly, for the question, and Katie and Colleen for those insightful responses. We are at time. It flew by super quickly. I can't believe that was a full hour, but there was so much rich information and experience shared from both the practitioner perspective in the face of Katie and the coaching perspective with Colleen. So thank you, ladies, for joining us today. I think a lot of people that were watching us live might now have a good starting point on their own Agile journey in the health and life sciences sector. And hopefully we all enjoyed this awesome conversation. Thanks for joining us.
Monica. Thanks,
Thank
Katie.
you so much.